usually opening our meeting time with an icebreaker or riddle of some kind, but I thought I would change things up. This month it is Mental Health Awareness Month, the month of May. And I thought it'd be interesting and maybe even helpful to share what's something that you do, maybe even a small something throughout the day or throughout the week that you do to help protect and strengthen your mental health. I know there's lots of stressors around us right now, and they're kind of there all the time. So if you wouldn't mind, just in the chat section over the next few minutes, if people are still signing on, share just a simple thing that you do. Maybe go for a walk or set social media aside for a while, but let us know what you do to increase your mental health. Yes, Nicole, I agree. The sun certainly helps. Kickboxing. All right. These are great. Lots of comments coming in. Unplug and go into nature. I sympathize with that big time. Yeah, a lot of walks. That's helpful. That's fantastic. Well, keep those comments coming. I did want to mention on that note, as we're talking about Mental Health Awareness Month, there are a ton of resources on the Washington County website, and specifically on the HSSN, the network email that's going out, that's keeping us connected. And shout out to Martin, who's done just a great job and has been diligent of keeping really relevant information on there. But one particular event coming up is some classes, and I'm posting a link for it right now in the chat. But these are just opportunities to join with others and get equipped on how to better guard and protect our mental health. And it's incredibly important. And I'm glad we're getting a chance just to see how you all are doing this morning. Okay, so as we go forward with our meeting, I do want to mention our public comment process. You can submit a comment through the link, and I'm going to post that right now. You can also, by 8:45, direct message Lindsay. And a standing public comment item has been added to our agenda. We're able to facilitate 2 per meeting, and they're on a first come, first served basis. So if you have a public comment, you can click the link or send a direct message to Lindsay by 8:45, and we have time in this agenda to address 2 of them. Okay, at this time now, we're going to pivot to a program update from Nicole.
Thanks, all. I've got to do the classic. Can you hear me all right? Wonderful. Good to be with you. For those I don't know, my name is Nicole Sting. I use she, her pronouns. I'm with Washington County's Homeless Services Division. It's great to be with you. There's certainly a lot happening in the housing world and here in Washington County. I'll start with kind of updates at the highest level. I think if you're like me, you're maybe watching the news a little bit too much, and you've already seen this, but we did want to share out. The president has released a skinny budget, a draft budget for Congress to consider. I won't mince words. It's not a great budget. It's very concerning for the work that we do. I'm putting a link in the chat for a summary that was put together by the National Low Income Housing Coalition. I want to stress it's incredibly important to be communicating our needs with Congress right now. We in Washington County are doing that, and we're very lucky to have a strong federal delegation that's in support of the work that we do. But this is a hard time for us in this industry, and I don't want to pretend like it's not or not talk about these moments. So I encourage you to look at that resource. Obviously, there's a lot of work that will happen before September and the new federal fiscal year. But it would encourage you to stay up to date. Some of the changes are changing the COC program to be a block grant program, changing the way housing choice vouchers would be delivered. It's unclear whether this budget has support in Congress, but we'll be watching that closely and reporting back in this space as we know more. But there are bright spots. Despite the federal budget, the state legislature has continued to invest in homelessness prevention, homelessness support, and ultimately affordable housing development. The Oregon Housing Alliance is a membership organization that we as the county are part of, that advocates in Salem for housing rights and investments. And I just put in the chat here a link to their legislative agenda. We're hearing great things about most of the legislative agenda investments. And I know actually this afternoon in a legislative budget committee, the state agency Oregon Housing and Community Services will be presenting more on the shelter, rehousing, and other executive order programs that were stood up in the last few years. So certainly some good news there. I'll also put a plug out there that on Friday, the legislature is hearing two investments for housing as part of the lottery bond bill. That's Senate Bill 5531. This includes important resources to preserve affordable housing. The governor is proposing $193 million for affordable housing preservation. For folks that have been around in the county for a while, you know that Wood Springs Apartments was one community that faced their affordability periods expiring. And because of state investments and the work of the Housing Authority of Washington County, we were able to stabilize the folks that live there and keep those homes affordable. And we know that across the state, around 8,000 homes are at risk of having their affordability periods expire within the next 10 years. So this investment is incredibly important to support folks across the state. And it also includes in that bill investments for housing infrastructure dollars. It's hard for jurisdictions to support infrastructure development that's necessary to help open doors to new housing. So that is also a lottery bond ask coming from the governor to the legislature that will be heard on Friday. So I'll share the fun, timely updates, but more information is on that second link I put in the chat. And as it relates to the SHS budget front, many of you know we have a programmatic budget that is finalized, and we're working to get contracts out to providers. Katie Gentry is not able to join today. She is our program implementation branch manager here in Washington County, and she'll be joining in future updates, probably take over this role of providing updates. She's not able to join because she's working hard to get our SHS service providers their contracts for next fiscal year. So there was a lot of information I threw at you, some helpful links to go learn more, but want to see if there's maybe a moment for questions. I think we have 5 more minutes until public comment. So happy to take any questions if there are not, and if there are questions, and if not, I'll yield back to Adam.
Okay, thanks, Nicole. I don't see any questions coming in. And as Nicole mentioned there, yeah, it's still time until 8:45 for public comment. Direct message Lindsay. But in the meantime, we'll get going on our speakers today in our training portion. We're going to be starting with information about Health Share from Adam Peterson. Adam, are you here? Are you ready? There you are.
I am here and ready. And I am I going to share my screen?
You should be able to, but if you need help, I've also got your presentation, Adam.
Okay, let me make sure I am good to go, and then I will get this started. All right, are folks seeing something yet? And okay, now let me see if the something that I'm wanting to show is the something that I want people to see. Is this saying healthcare and homelessness case conferencing, Washington County, May 2025? Is that what folks are seeing?
Yeah, you're looking good there.
Thank you, folks. So you know what? Actually, I should have done this first. I should have introduced myself first, but I digress. My name is Adam Peterson. I use he, him pronouns, and my role at HealthShare is the portfolio manager of healthcare and homeless services integration. It's a new role at HealthShare, and I've been really working closely with a lot of our county partners in starting to figure out how we can better integrate healthcare into our homeless services and getting the people who are engaged in coordinated entry programs the best healthcare that they possibly can. And I should also mention that I serve on Washington County's Homeless Solutions Council with Nicole and the team there. And so really was asked today to come and just present what HealthShare is doing in this space and how we are moving forward, including what some of you, I know, like I saw Cameron here in the in this meeting, and I know a lot of you are really close to this work, but I wanted to just level set and show what we've done to this point, and then talk a little bit about where we might be going and get some ideas from you all about, are we on the right track? Are we thinking about the right things? And just really open it up for thoughts and collaboration. So to start, what I was going to present is like I mentioned, what we're already doing, which is healthcare and homelessness case conferencing. And what I mean by this is that historically, our healthcare systems and our homeless services systems really had not had direct ways to communicate with each other outside of potentially knowing the right person to connect with at the right clinic, and you've got to have the right case manager who knows the right people and knows how to get the information. And what we learned is that that is not an efficient way of getting people the care that they need. And so Washington County in 2020 began a pilot program with Kaiser and Providence health plans to begin to create a case conferencing space for people who are on the homeless services continuum in order for them to present the people that were in their care and have healthcare navigators talk to them about how to get the healthcare that they needed. And what it started to do was shift the thought from, this is not just my person, this is our person. And we shifting from my clients to our clients and from my resources to our resources. And since 2020, this has now, this process has now expanded from first in Washington County, now to Clackamas County, and then finally into Multnomah County in November of 2024. So what is it? It is really focused on what is the person who is on or who is in coordinated entry programming, what are they wanting? What are they focused on? And the people are identified by the housing case manager who is working with them as having an unmet health need, and that could be a physical health need, a behavioral health need, substance use health need, or a durable medical equipment or transportation to medical appointment need. And it could be really any need that is identified, and that housing case manager brings them brings that story and those questions to a once every 2-week meeting where there are representatives from all health plans that are underneath the HealthShare network, and that would be Kaiser, Providence, OHSU, Legacy, or Care Oregon, that are there to hear what's going on with the folks and to really help to get them to the right level of care and help them navigate a system that previously hadn't really had this level of navigation support available to them. And one of the things that I think that makes this really unique is that we in the health system probably have a pretty good idea that if somebody like we may have a thought that this person has a ton of substance use needs, and we would really want to work on those. But if that's not what the person is identifying as what the need is, that's not what this group is focused on solving. And so what we really are trying to do is to solve the problem that's presented to us as what the person identifies as what the need is. And so we get that patient story, and then we bring this cross-sector team together, and it's focused on finding the solution to what the need is, and then creating an action plan that we all agree on to get that person get their needs met in the best way possible. So when we say care conferencing or case conferencing, it's action oriented. We're moving people experiencing homelessness into housing as quickly and sustainably as possible. And we're doing this through getting their healthcare needs met. The theory of change is that by meeting healthcare needs, it's going to allow a person to better engage in their housing and to get to a level of stability that they wouldn't otherwise get if healthcare and housing were not working together. And when we are always trying to work towards a measurably effective and ensure that the practice is an effective way to reach the desired outcomes. Again, we're only working on what the person is saying that they want to work on first, and then through that, hoping to identify other health needs that could be addressed through building of trust and through building of showing effectiveness. We know that historically, folks who are identified as homeless are not treated well within the medical system, and that there is a level of trauma that is associated with engaging with healthcare as a homeless member, and we're really trying to change that. And then also just through team building. Through developing of relationships with homeless services providers and care coordination teams from all of our health systems, it's creating a better understanding about how to navigate health systems and creating better collaboration outside of a case conferencing space that is really, really valuable and helping people not just need to wait every 2 weeks to get somebody's need met. So this is kind of how it's happened here in our region. Is that it started in, as I mentioned, in 2020 as an idea, moved into a pilot in 2022, and then really started to gain steam and momentum in 2023. And then in 2020, at the beginning of 2024, is really when we started to do biweekly case conferencing and brought all the health systems in, engaged with HealthShare and all of our health systems and our folks from Washington County. Now, as I mentioned, it's every 2 weeks, every Friday morning or every other Friday morning, we're doing our case conferencing. And if for those of you who know Nathan Howard from the Street Outreach team in Washington County, he is an incredible facilitator who creates a really welcoming space and it does a fantastic job of facilitating our healthcare and housing case conferencing work. At the time of this development, there was 62 folks who had been through healthcare case conferencing in Washington County, and this data was produced at in 2023, and some of the data is now pretty still accurate in that 50% of the folks are over the age of 55. That holds true regionally. We've now had 243 folks who have engaged in healthcare case conferencing in all 3 counties, and the age demographic holds true, where you all know, and I think that it's been discussed in this space before, that there is an aging population that is experiencing homelessness at a much higher rate than had previously happened before. And we are now and now that we've got data behind it, we're trying to align the healthcare system and the healthcare needs with that. That folks have been unhoused for an average of 6 years. That also is holding true. And folks are not engaging with their primary care prior to engaging with case conferencing. And part of our goals through this is to identify that need and to then get people engaged with their primary care and a care team that actually meets their needs without having to use higher level resources like the emergency room or like urgent care when folks are not engaging with their primary care. So we're really trying to change behavior by creating a trusted treatment team that can follow folks across the health continuum and get people what they need prior to having to go to the emergency room. And so where is it now? We are as I mentioned, we've now developed a space in Washington County, Clackamas County, and Multnomah County. They are county specific. And because we want to have localized resources that are engaged with the community, and trying to navigate to the right local resources. So in Washington County, it's mostly healthcare folks who are engaging in Washington County. In Clackamas County, it's mostly healthcare folks who are engaging in Clackamas County. And then Multnomah County is a brand new program. As I mentioned, we started in November of 2025 or 2024. Their program is focused on supported housing, or those who are engaged in permanent supported housing and over the age of 55. And so it's a very different, much smaller subset of folks that we're working with, but also learning a lot about how we can support that people to retain their housing and retain their permanent supported housing. Whereas in Washington County and Clackamas County, it's really anybody who's engaging with coordinated entry is eligible. So a participant story, just to share it, is that just start with the housing situation. Was somebody was living in a home that was doubled up and unstably housed. There were 5 people with no rental contract in place. I should mention that this individual also didn't know what health insurance they had or how to engage with it. So to start with, the first thing that was done in this healthcare case conferencing was establishing, yes, this person has health insurance, and here's who they're assigned to with their health insurance. Soon after, they were admitted to the ICU for 2 weeks and discharged ready to discharge to a SNF, but wouldn't be accepted without a discharge plan. And then the housing team was able to connect with their healthcare team to create a plan that would support them through home health. And so it was first, like I said, identifying which coverage they had and how to get connected to it, then getting the right people from the health plan assigned to folks, which is great, and then working all together as a team to create a plan that would allow for discharge to a SNF, which is great for everybody. So that is what I've got for my formal presentation. Let me make sure that I'm stopping sharing. Okay. I also want to, as of yesterday, something pretty cool happened in that this project and our healthcare case conferencing work was highlighted in what's called the Lund report. I'm going to put a link to in the chat about to the story that was in the Lund report. And, we're not seeing a whole lot of positive news about the engagement or the homeless services budgets, or about really successes that are happening in this space. And so I think it's really important when we are seeing things that are working and are positive, that we are able to share the good things that are happening too. And I'm really glad that this article's out there to highlight the great work that our counties are doing to create these collaborative partnerships and relationships to better serve the people that we're all trying to work with. A couple of things just to mention. While this is a HealthShare sponsored project, people who are engaging in healthcare case conferencing do not need to be HealthShare members. They can be Medicare only. They can have no coverage at all. They can have Trillium. The idea is just bringing the right people to the space to get them the care that they need. So there, again, we've had 240 some folks who have been through this process. Only 130 of them have been HealthShare. There's been about 20 Trillium members, about 37 who were Medicare only, and then about 55 who were uncovered altogether. So we're, and in this, we're learning a lot about what do we need to do to help people get connected to coverage that could help save their lives, or to get them the care that they need. And when we recognize someone isn't covered, how do we engage with them? What does that look like? So this process has been just incredibly cool and valuable for like the engagement from all sectors has been pretty incredible. And so when I was asked to present today, I wanted to share that with you and then start with a conversation about kind of thoughts. Like, does this seem like we're on the right track about establishing these connections and relationships? Have folks experienced it? And thoughts on the process from anybody? And I guess I'll just open it up for question, comments, thoughts that people have. Great question. I see Megan in the chat put down, how do mental health needs fit into this model? That is a really great question. And we do have folks who are behavioral health, like folks who can navigate to the behavioral health world are in the healthcare case conferencing space. There are representatives from an organization called Care Oregon, which works on all of the behavioral health. They hold the contracts for all the behavioral health providers of the Health Share Network, and as well as substance use providers. And they are there to help navigate folks when they have behavioral health or substance use disorder needs. Elena Zip is the representative who goes to the Washington County meetings. She is the head of the regional, or she's the supervisor of the regional care team for Care Oregon and for Washington County. And she's a really incredible resource at helping people get connected and support those connections to care. Cameron, I see your hands up. How are you? And I would love your question.
Hey, morning. Full disclosure, I've participated in the healthcare case conferencing for a couple of my participants, and some it worked wonders for, and for others, they, like Adam spoke to, they have to be willing to engage in their care. So even like showing interest in the process doesn't mean that they're committed to the process. So sometimes it still doesn't work out. But to no fault of anyone in that case conferencing who show up and have the access and the means to find the resources that they need. Working in a population where high acuity, like this is a fantastic and amazing resource that we have in Washington County. And so just kind of anecdotally, like, awesome, yay, go team. And the questions I had were, can anyone submit to to the list to be put on the case conferencing? I know that if you're in the SHS programs, you probably know Nathan Howard and know how to reach him. But if you're not in those programs, can anyone else access this resource to support their people? And then the other question is, if you are working with someone who doesn't really know what their what their insurance is or anything like that, what's like the first step? Is there anything that needs to be known to get them on case conferencing, or can that kind of be assessed and then take it from there?
Great questions. So Cameron, I'll be 100% honest. I don't know about your first, like the answer to your first question about, my understanding for Washington County was anyone who's engaged with coordinated entry can be involved with case conferencing. So I'll follow up with Nathan, get you an answer to that question and get it back to whoever I should, so that it can go out to the group. Is that reasonable? And the second one is if somebody doesn't know if they have healthcare coverage, if they're who their primary care is, totally fine. Nathan sends us emails all the time with this person, they'd like to be presented at case conferencing, what's their coverage? And then at that point, me or someone from my team will go ahead and look up that person's coverage. Sometimes we're able to find a lot of information that we're able to send back. And sometimes we're not able to find any. It doesn't prevent them from being case conferenced, but that information then becomes available to the human, which can be really valuable. And just even knowing what they have and what they have access to can be really great information. And we're trying, just kind of like I mentioned, we're like, this is one tool. The healthcare case conferencing is one tool that we're working on to meet needs. What we're really trying to do too is to solve a bigger problem, and that Cameron's identifying is some people just don't know what they have. And if they had it, they would that would be great for them to know, and they shouldn't have to go to a case conference just to learn that information. And so we're trying to figure out, how do we get that information to the people who could most benefit from it? How do we share that? How do we make that a much more accessible information when a lot of people have either lost their cards, don't have the documentation they would otherwise need because of their homelessness status? We want to make that available to them, and we're trying to solve for it. So that's just a kind of bigger something we're working on right now. Did I answer all your questions and comments, Cameron? Thank you for talking about case conferencing. I think you're right on. This is not the solution for everybody, because people do have to want to be supported. And there was a question in the chat too about SPMI folks are suffering, people suffering with SPMI will not engage and end up in the ER. How are you helping these folks? As with any, this is a 100% voluntary process. And therefore there is not everybody is going, this is not going to meet everybody's needs. And the needs of the SPMI population, or for those just severe and persistent mental illness, is what SPMI stands for. That is an area that we're still working on. We know this is a huge challenge, and we know that these folks are really taking up a lot of staff time in the homeless services providers, and you're really trying to get these folks' needs met, and it's a struggle. And so we're trying to kind of figure out how we do that better and in partnership with you. And I don't have a great answer for you other than we're aware of the challenge and actively working on it. And then Sundry asked, is there an initiative to sign individual up or connect with local agencies and resources while they are in or leaving emergency services? Great question. These are the healthcare case conferencing often becomes a lot about things that aren't just healthcare or housing. They can become about connection to local community resources as well. And some of these folks are coming out of emergency spaces, and that's why they're being brought to case conferencing. And so it's really inclusive of those needs, but not specific to it. And is there any initiative to sign individuals up or connect while they're leaving emergency services? There is a lot of work going on in the emergency rooms, but not directly, it's not directly answering your question, but there are a lot of folks trying to engage with people when they are leaving the emergency room. Sometimes it's really effective, and other times it's just not. Great question though. Other questions, thoughts, comments, things that folks are on folks' mind about healthcare?
Okay, great. Thanks, Adam.
Well, thank you all. I want to just appreciate the opportunity to talk to the group. I will put my information in the chat. And if anybody has follow-up questions or just things that you, that after this conversation spark your mind, hit me up. I'm happy to chat about this anytime. So thank you all for your, for what you do, and for all your partnership in this work. Appreciate you. Bye.
Yeah, likewise. It's very informative. I really appreciate your time. Okay, we're going to pivot now to Carly and Fabi for Homeless Services Division of Quality Improvement Initiatives. Carly, if you're ready, go ahead and take it away.
Sure. Can everybody hear me okay?
Yeah, we can hear you.
Okay, great. Hi, thanks for having us here today. We'll start with just a couple of more personal introductions. I'm Carly Brandini, Quality Improvement Program Coordinator here at Washington County, and Fabi and I live kind of in the business operations branch portion of homeless services, and I'll turn it over to you, Fabi, for an introduction.
You're on mute, Fabi.
One for 8
Sounds like maybe you were on mute, Fabi. Are you?
There's a blanket PO associated with it. So
We could see lips moving, but we can't hear you, Fabi.
yeah, it's in chat, by the way.
Maybe if you have that little arrow and want to just check your microphone settings, I will move us forward, and then hopefully, Fabi, you can jump in as soon as you're able. Martin, I think you were going to share the PowerPoint for us. Is that possible?
Yeah, let me get set up here. Should be set up. Everyone seeing the PowerPoint?
Yes, perfect. Thank you. Okay, well, I will jump in, and Fabi, hopefully you'll be able to join me here shortly. So today we're just going to talk a little bit about our quality improvement efforts here at Washington County. And if you have any questions as we're going through, or if you think of any questions after our time here today, Fabi and I will put our emails in the chat at the end of the presentation. So feel free to just reach out with any questions. We'll go to the next slide.
Okay.
Okay, so this is just kind of an overview of all of our current and ongoing quality improvement efforts here on Fabi and I's team. And so what we oversee is our COC subrecipient monitoring, and that occurs yearly with all of our programs who receive COC funding. We have our SHS and braided funding monitoring that occurs. Each agency is monitored once over a 2-year period, so a biannual basis. We are overseeing our annual performance evaluation, which is a yearly project that has been part of the county's quality improvement efforts over the past few years. And that project evaluates all of our SHS supportive housing services funded programs. And then finally, a new monitoring and quality improvement effort that we are in development with is our financial monitoring. So we are going to work to incorporate this into our existing monitoring that we're doing, so that it's not something additional, but is just happening in alignment with our other monitoring efforts. We have expanded some of these efforts over the past 18 months. And so the SHS and braided funding monitoring is new for us. And so we're continuing to kind of work to align those tools and develop those tools, as well as work to align our COC monitoring and our SHS monitoring, so that agencies who have programs that are funded by both of those funding sources are not having to go through drastically different monitoring processes, that it's as aligned as much as is possible, so that we are, decreasing any duplicative work or additional steps that folks have to take. And I just got a message from Fabi that it's not unmuting for her, so I will do my best on her slides and carry on. And if I'm missing anything drastic, Fabi, feel free to put it in the chat until you can hopefully resolve any tech issues. It sounds like it's not letting you unmute. So, okay. So program monitoring. I'll talk about both COC and SHS or braided funding monitoring in the same context, because as I said, we really try to align these efforts and not be duplicative or ask anything above and beyond what we need to of our partners as they go through this process. So what we are looking at during program monitoring is really an overview and an in-depth picture of how our service is being delivered and what are the policies, procedures, processes that an organization has in place to support this work that they're doing. We developed service component monitoring frameworks and operationalized this process and rolled it out in 2024. Fall of last year was when we first started doing the SHS monitoring. There is, it's broken out into two parts. So we have a desk monitoring process and a participant file monitoring process. And I'll kind of talk about that a little bit more as we go through. And then we've incorporated a feedback loop. So organizations who've been monitored, we're rolling out a survey so that whether that's COC or SHS, there's an opportunity to provide feedback on what worked well, what are any areas that we have for improvement or development. Was the material clear? Did you know what was expected of you, etc.? So that's part of our sort of feedback loop that we've incorporated. We started monitoring after we ran a pilot in spring of 2024. This pilot monitoring included 4 partner agencies, and similarly, we incorporated feedback from those 4 partners on their experience in order to use that information to build out the full monitoring project. We have a calendar that we provide to all of our partners so that they can know when their monitoring window is. And we'll talk a little bit about kind of our pre-monitoring communication as well. But that calendar helps us track that we're meeting our goals as far as frequency and cadence of monitoring for our COC partners that are yearly, as well as our SHS partners who are once every 2-year period. We do provide an opportunity for partners who have both of those funding sources to decide if they'd like to do all of their monitoring together, or if they'd like to separate that out and do COC at a different time that they're doing their SHS or braided funding window. Okay. So pre-monitoring. So we are we include about a 6-week ramp up window for folks who are being monitored. The tool has been shared with everyone in the different iterations as we make improvements or make edits or add any clarity to that tool. It is shared as well when those edits are made. But when a partner is coming up to their monitoring window, they receive the tool that's really individualized to the specific programs that we're going to be looking at 6 weeks prior to that event. We also share kind of the week that we're going to do our desk monitoring, and then provide, kind of a 2-week availability to schedule that on-site monitoring piece. The on-site monitoring is our participant files, and then the desk monitoring is that's done all electronically. Is ideally how we are doing the desk monitoring, and I'll get into that a little bit more. We also provide office hours. These office hours are open to both our COC partners who are coming up on their window, as well as our SHS and braided funding partners who are coming up on their window to attend. So we offer those 2 times per month, and folks who are on the calendar to be monitored within the next 2-month period are invited for those office hours. So we've tried to kind of like have it be a flow of folks who attend so that it can be really individualized support and a time for like one-on-one questions or any specific needs that our partners have, versus open to just every partner. regardless of if your monitoring window is in 2 weeks or 8 months. So we've really tried to keep that pool as small as possible so that folks can get any individualized support that they may need.
Okay, so the 3 dots probably.
So our two-part monitoring framework. The first part is our desk monitoring, and this really is focused on policies, procedures, and processes that really support the work from the agency side of things that is being carried out. So what are those tools that the agency has in place, or what are those policies that the agency has in place that serve as really guidance towards service delivery? So we're looking at some specific policies like a termination policy, ethical standards, equal access, non-discrimination, grievance. Those are some of the specifics. And then we're looking at if an organization has any individual program manuals or guides that they use to kind of inform and provide structure to the work that they're doing. That's all included in the desk monitoring portion. These are all submitted electronically. So we aren't meeting in person for this. We're meeting, we provide either a Dropbox, or they can be sent as part of a zip file, or whatever's most convenient, working with the agency to provide all of these policies and procedures. And yeah, I think that was everything for that slide. We'll go on to the next one. The next part of monitoring after the desk window has closed is our on-site monitoring. And so that's when we're really looking at participant files and the service and work that is being done with those participants. So we share our randomly select HMIS numbers and share those with our partners at least 3 weeks in advance so that they can start to prepare for the on-site monitoring. We have a checklist that we provide in order to sort of really just kind of guide that process. So when we show up on site, there's no surprises. Here's what we're looking for, and we we have the ability to just look at hard files, obviously, or if partners are use more of like a external case management software. We have case managers sit with us and kind of walk us through service transactions or pulling up each of the requirements within their own system. And we also are accessing HMIS to show documentation of that those requirements are being met. So it's really kind of a variety of how each individual agency structures their case management and has their record keeping. We're flexible and can kind of work with whatever that looks like on an individual agency basis. But we're really looking at participation in Community Connect, referrals, eligibility documentation, releases of information, and then for programs that have a specific required cadence on any phased assessments or service transactions, we're looking at those as well as part of our on-site monitoring.
I can do it.
Oh, yes. Okay, you're here.
Hi,
Great.
everyone. Thank you, Carly. My name is
Yes.
Bobby. I use she, her, pronouns, and I'm the evaluation and monitoring specialist. Thank you for giving me grace while figuring out my mic. So the framework and scoring. So for each portion of the monitoring is a pass or no pass for each framework. We do a not applicable if that wasn't a program standard when the participant was enrolled. And we provide a final summary report to the organization about 4 weeks after file monitoring. And the final summary report includes any concerns or findings. A concern is less severe than a finding, but if it is presented again in a future monitoring, excuse me, it will rise to a finding. And a finding is if more than half of the participant files are missing a requirement. And this would call for a correction on an established timeline. So during the report, we would highlight and give an exact timeline of when we would want those documents uploaded into HMIS or emailed to us for the organization, and make an amendment on our end from that report. Next slide, please. So our findings and takeaways. Overall, the partners involved in monitorings are meeting the contract requirements included in framework, and partners demonstrated active case management with participants, and there was evidence of this in HMIS. Providers felt prepared for the monitoring and had clear guidelines and felt supported during the process. And we are in development of a partner survey for this 2024-2025 monitoring, and surveys will be sent out to organizations who have participated in monitoring, encouraged to share feedback on the processes and any future ideas for improvement. And this is how we are changing or adding or removing any portion of the monitoring that might be unnecessary. And we are also with office hours, we were able to develop a FAQ of the most common questions for the SHS monitoring portion of it. And those questions were gathered from November 2024 to March 2025. So it's like a good timeline. And those FAQs are being sent out in the initial email starting in April and moving forward, just to prepare organizations a little more, especially if their monitoring is combining COC and SHS at the same time. Next slide, please.
Sorry, I had to find my unmute question there, or unmute button. Tara, I just want to acknowledge your question, and I will, I can't type and talk at the same time, so I will get a response to you in the chat. And I know that we just met and had your monitoring about a week or so ago, and we are following up on some chasing down some items for you and tracking down some items for you and kind of getting you the answers to the questions that you had. But I will come back to that too. So the annual performance evaluation, so shifting over to our next effort. So the annual performance evaluation is done yearly, and we just recently have sort of shifted the time frame of when we are going to do this evaluation in order to capture a more lengthy period of time in our data. So it is yearly, and this is specific to our SHS funded programs. So it is program performance for all of those individual components like shelter and HCMS, enhanced rapid rehousing, liaisons, outreach, and some of our individual single programs like workforce development or our furniture services. So those are all included in the annual performance evaluation. And as I said, historically, this has been a spring activity, but that limited the amount of data that we could look at and collect to only half the year. And so now we've moved this into a July and August activity, and that allows us to collect a full year's worth of data. We're looking at contract performance metrics, and then there is additionally a financial metric evaluation. Those metrics typically don't change too much, but we're looking at invoicing and financial practices with each organization. The annual performance evaluation, it provides an individual agency score to see, kind of how they're doing with each of their service deliveries components, as well as provides sort of, it gives us a fair amount of data, actually. It's not only agency specific, but then we can look at all of our shelter providers and look at how how performance is trending across all of our shelter providers. And then it also provides a system-wide performance data for us. So it's informative and just kind of helps us measure where our system has been at for the past year, and look at how we might want to make adjustments or any shifts moving forward. So that's the annual performance evaluation. And then lastly, we're going to talk a little bit about financial monitoring. So this tool is being developed, and we're working with our fellow business operations branch colleagues who are doing some project work around risk assessment and looking at the financial documentation requirements. So we are working with them to streamline and create a financial monitoring tool. We used our COC financial monitoring tool as kind of the jumping off point for this project. However, we're really, again, trying to look at, okay, how can this be streamlined? How can we ensure that we're not asking for any duplicative requirements in other areas that we might be looking at, and how can we use this to inform corresponding supporting documentation requirements and sort of wrap it all together. We're hoping to roll this out in early fiscal year 25-26. And so we're still in the, continue to be in the last couple months of like developing that and finalizing that tool. And we'll solicit some feedback from partners as we roll it out as well, similar to how we've done for our pilot monitoring, as well as our new survey that we're rolling out for SHS and braided funding monitoring. Next slide. Oh, perfect.
So our next steps is to continue refinement of the framework based on any contractual requirements and provider feedback. We're continuing our biannual partner agency monitoring and continuously aligning with COC and other monitoring practices, as well as schedule and host AP kickoff office hours. The annual performance evaluation, AP. So for the annual performance evaluation, we will be hosting office hours as well. And those will be provided once we have them scheduled.
Thanks, Carly. Thanks, Bobby. We're doing really well on time and can accommodate some questions if anyone wants to add any into the chat or raise their hand.
Cameron.
So for example, my agency hasn't done this for the SHS programs yet. So that's coming. So this was very helpful to see more of what to expect. With the financial monitoring, since that's like not fully up and running, for those who've already completed their monitoring, like as the broad stroke of it, is the financial monitoring like coming back around to do just that part of the monitoring, or like when should we right? So like ours is going to be like end of summer, and so that sounds when financial monitoring is more or less going to be ready to go. So like could we maybe be getting the whole spectrum of the monitoring at that point, because it'll be ready? And then for those who've already done it, are you coming back around for them to do the financial part?
Yeah, I think we'll roll it in as it's yes. So if you are an organization that is not on the schedule until after we've rolled out the financial monitoring, then yes, it would be rolled into your monitoring. For those organizations who have already gone through monitoring, I think we're still looking for a little bit of guidance on if we are doing something abbreviated with them or if we're just waiting until they're next on the cycle for monitoring. So I don't have an answer to that yet. As we roll it out, we'll get some feedback and make a decision and then communicate that out. And again, we're really trying to keep it as manageable and not duplicate any efforts elsewhere. And so, if it is that we are going back and doing an abbreviated financial only monitoring with organizations who have already been monitoring, it would look similar to the desk monitoring where it's online. We aren't meeting in person. And there's a window where folks are providing some additional information to us to make it kind of as low of a lift as possible, knowing that they've already completed their monitoring window.
Okay, thank you. And then just on it sucks to do it again, right? And like not wanting to like go through those efforts. And as it speaks to like the financial aspects, given the budget conversations and things that are happening across the board, it feels like a very worthy venture to do that financial monitoring, even if people have already completed their monitoring, because how agencies are responsible for their finances does impact the greater system, and having that kind of feedback on how everyone's doing, I think is really going to inform our budget issues going forward too. So, end user feedback there right in the moment, but yeah, I'm excited to kind of see how this actually plays out.
Yeah, I appreciate that. Thanks, Cameron. And Tara, I'm still in the process. I want to just fully acknowledge your question in the chat. I don't have an answer for you yet. I'm still in communication with my colleagues over on the program implementation branch to track that down and send it to you. And then how often will monitoring take place? So COC monitoring is a yearly requirement, so that will not change and will stay the same as it has been last year. This year, all of our COC programs are monitored yearly. SHS and braided funding monitoring organizations will be monitored once in a 2-year period, and then continue to be monitored once in a 2-year period is the current cadence that we have, and I don't foresee any adjustments to that. But I don't know what down the road will bring us. This is our we just started rolling out the SHS monitoring in fall of last year, so we've gotten through, I think it's 6 or 8 organizations. So, as we go through, we're learning, we're understanding how to structure it, how long to give organizations to prepare, and sort of how Fabi and I can, how much time we need on our side to sort of do that work and schedule everything and do the site visits and whatnot. So I would anticipate that it continues with that sort of cadence of once in 2-year period for SHS. However, I can't necessarily commit to that. It will just depend on how it continues to unfold and if there's any direction to change that. But that's where we're at right now.
And it was there, just in a different system.
Great, thank you, Carly. Thank you, Bobby. Okay, we're doing great on time. We did not have any public comments come in, and so we are going to move forward into our general business and get an update from Solutions Council. Kim or Chelsea, are you guys available and have an announcement?
Hi, yes, this is Chelsea. I use she, her pronouns, and I work with Washington County. And for folks who don't know, we have the Homeless Services Solutions Council. They help provide guidance on the county's homeless services system of care, and they give us counsel and advice on our policies, procedures, budgets, strategic planning, and more. And we meet monthly, and last month in April, we actually had a staff from Metro come to talk about oversight from the Tri-County planning body and their regional goals for all 3 counties. That includes things like healthcare alignment. Adam works really closely on that regional goal. Things like coordinated entry and making them more aligned across the counties. So there's a lot of great work, and the council got to hear about the regional goals and ask questions about that. And then they got an update on the programmatic reductions and planning for this next fiscal year. And they've been getting regular updates about that and giving us advice and counsel on it. Coming up, we're going to meet in the middle of this month. We're going to have Katie come and ask for consultation on some new programs coming. That includes the access centers, transitional housing, and pooled funding, which is going to be used for kind of short-term financial solutions to avoid homelessness. And then we'll have a update on the point in time count for them. We're getting that data right about now. So that's what's coming up for Solutions Council, and doing a lot of great stuff there.
Great, thanks, Chelsea. Okay, just a few announcements, and we'll be done a little bit early today. But if you or your organization would like to present during this time, we love this time, keeping it informative and helpful. You can see in the chat that there is a link there where you can introduce yourself and what you would like to present. Next month, we are meeting May 7th at 8:30 in the same format. And then lastly, if you've got an encouragement, an event, or a kudos or highlight that you would like to share with the group, feel free to use the chat or unmute your mic and take a moment to let us know what you have going on. I'll mention that we have at our Hope Center in Hillsborough, I have a groundbreaking event this coming Tuesday for our new Client Choice Pantry. We're starting construction. So if you want to come by and have some cupcakes, you're welcome to come by at 2 o'clock. Next meeting is, I'm sorry, yes, you're right, June 4th. Thanks, Lindsay. I'll put the Hope Center info in the chat. All right, thanks, y'all. Have a great week.
Thanks, everyone.